Today we're wrapping up Movember with an important conversation that you don't hear often or often enough: male breast cancer. We're breaking down the facts, the myths, and why awareness matters for everybody.
Dr. Brandon Bentley with the Department of Family and Community Medicine at Wellstar MCG Health is here with us. And for our Wellness Wednesday, we're discussing male breast cancer for Movember.
Hey, good to see you.
Good morning.
Good to see you both. Good morning.
Awesome. Okay, so how common is breast cancer in men?
It's relatively uncommon. So less than 1% of breast cancers discovered are going to be in men. And the overall incidence is about 1 in 800 to 1 in 1,000 for men to develop breast cancer over the course of their life. So it's not very common, but it does exist, and it has very big outcomes that can be significant to quality of life and longevity of life. So we do want to make sure that men are aware about it.
What are some of the symptoms, Dr. Bentley, that we should be looking for men to be able to spark a conversation with their doctor?
These symptoms can vary, but they're not that different than they are in women. So if a man notices a lump or swelling, usually in one side, this is usually unilateral rather than bilateral. Any tenderness that they note, though usually these lumps can be painless. If the soft tissues, the skin is red and flaky, if you notice that the skin feels thicker, which is hard to describe unless you have it yourself. And then any retraction of the nipple or discharge from the nipple can all be signs and symptoms that there's something significant going on that needs further investigation.
All right, so what are some of the risk factors for getting this form of breast cancer, and how can men reduce the risk?
So some of these risk factors are things that we can't control, and some of them are. So genetics are something that we are just not able to change about ourselves. So some of us are at an increased genetic risk of breast cancer. Some of our other risk factors are liver disease, alcohol consumption, obesity, and some of those we can influence. We can reduce our alcohol consumption, we can increase our activity levels, we can reduce our weights. There's been shown that physical activity has decreased the risk of breast cancer in women, and while that hasn't necessarily been studied in men, it gains the reason that if it decreases the risk in women, it likely decreases the risk in men as well. So there are factors like age and genetics that we cannot influence, but if we can take control of the things we have influence of, get out there, eat healthy, and get some exercise, we can reduce that overall risk, even though it is low to start with.
You mentioned the symptoms and what to look out for, which women also are using those same qualifications too. But how does the breast cancer differ in men from women?
So the breast tissue is breast tissue, and I think that's something that we all need to understand, that just because the shape, size is different in men and women, it's still breast tissue. So this can happen, but how it differs is that it's usually found in younger populations in women and older populations in men, which has a role in the significance of the diagnosis. The average age is in the 60s and 70s for men, which means that they're finding it at a more advanced stage and has more aggressive features. So that's one of our mainstays and differences between men and women, because the presentation, the lump, the skin changes, those are found in both men and women.
Okay, so we know for women you need to get screened at a certain age, or if you have certain genetics. How is breast cancer diagnosed in men?
It is actually diagnosed the same way, and this is something that, when we have any concerns that we bring up, we try to break that stigma, having that conversation with any gentleman who comes in with a concern like this, that it's still mammograms. Right. It's still mammograms, it's ultrasound, and so it might feel awkward being in that office and maybe being the only man there, but it's very important to continue along that treatment path and that diagnostic path, that despite feeling uncomfortable, it's important that if there is a concern that you share with your physician and they feel like this is an important modality to go check it out, that you follow through with checking.
And I think the biggest takeaway as well for men, you're not alone on this too. Even if it is 1 in 800, that means there are more people out there that do have that.
Absolutely, and we touched upon this with our topic on mental health. There's a lot of stigma regarding men's health and men seeking care and admitting that there might be something wrong. And so I want to encourage conversations to be had because that stigma, that barrier needs to be broken in order for men to be able to get the care that they need as well.
All right, there we go. As we wrap up Movember, Dr. Brandon Mittley, we appreciate the time.
Thanks
have a
for
great
having me here.
Thanksgiving.
Same to you both.